Dengue fever, a disease few are aware of. Dengue is transmitted to humans through the vector of a mosquito. Dengue fever is prevalent across the world and in some areas is endemic. One of these areas is Bangladesh.
Bangladesh is an incredibly vulnerable region, I would say, because there already is not a very robust public health and just general health infrastructure in the country.
Bangladesh is a country located in Southeast Asia with a population of 16 million people. Countries that are most vulnerable to climate change are often the ones that least contribute to the problem, and Bangladesh is a prime example. Bangladesh is one of the world's most vulnerable countries when it comes to climate change.
We know that because climate change impacts ecological conditions such as temperature, precipitation, humidity, that in turn is going to impact both the geographic location where vectors occur and then also their abundance.
Climate change and dengue are related in the sense that climate change increases the area where dengue is able to be transmitted from mosquito to person.
So we know that with climate change, we're seeing vectors and thus vector-borne diseases in places where they've never been reported. There's not a lot of great surveillance that goes on in these parts of the world, which makes them very vulnerable.
Bangladesh currently utilizes both hospital-based and web-based surveillance to monitor dengue. However, studies suggest underreporting or misclassification of dengue deaths. Inadequate knowledge of case definitions among district health personnel compromise complete reporting even within the public health surveillance system. These reporting deviations can be seriously misleading in Bangladesh, where reliable estimates are urgently needed for effective resource programming.
There's such a black hole in terms of what we know about what's out there in terms of vector-borne diseases and where the risks are.
A systematic approach and a clear research agenda can quickly bring forward the frontiers of knowledge.
Climatologists do their thing, and then health professionals, public health people do their thing, and these groups are not accustomed to working together.
Better understanding of dengue will not only feed into operational policy for dengue control, but also provide fertile terrain for vaccine application strategies in the future.
And the reason why we need these communities to work together is to protect public health through building surveillance systems and through building predictive models so we know what areas are at risk and what we can do to sort of help protect those communities.
Just this year, Bangladesh has already seen around 4,000 cases of dengue.
Climate change is an issue which does not stay within the confines of national borders.